I come from 4 generations of doctors dating back to the 1800s in my family. My dad had a tremendous influence in my life. Not only was he my father, but he was somebody that I thoroughly looked up to as I was growing up. I spent a lot of time in his office. I spent a lot of time in the hospitals. And early on, I was kind of like very interested in medicine. Since finishing my residency at Jackson Memorial Hospital and the University of Miami in plastic surgery, I've specialized only in plastic surgery, and today all I do is cosmetic surgery. To me, the most important thing in building my practice has been the relationship that I have been able to establish with my patients. I think you have to be empathetic, you have to be sympathetic, and you have to be able to understand that every person who comes into this office needs attention. As the patient walks into my office, the first thing they're going to do is they're going to meet me. They're going to come into the console and we're going to have an open conversation. The first thing that I do is, what can I help you with? Because I never assume that I know what bothers them, because what I see may not necessarily be what they're complaining of. Once they tell me what they desire, then I try to delve a little bit more into their personal life as to where they're at in their personal life. Are they having social issues? Are they having marital problems? Because that's going to guide me as far as the whole of the patient. Then I go to the technical part. What is it that they desire? And based on my technical expertise and my aesthetic sense, I will suggest certain things to the patient. I think it's important for a patient who's contemplating cosmetic surgery to be able to see before and after pictures of patients that have been previously operated on by the surgeon they're contemplating. Ours is a very visual specialty, so this will give a very, very good picture of what to expect from that particular surgeon. I think it's important to look at not just one, not just two, but see multiple, so that you see that there's consistency to the work. Subsequently, they need to be able to know that their expectations are going to be met by that surgeon. If their expectations exceed what the surgeon can do, then they maybe should find another surgeon. I think it's important for patients to realize that we do continuing medical education credits. Not only does a licensure require you to maintain a certain amount of continuing medical education credits every year, but in addition, if you are certified by the American Board of Plastic Surgery and subsequently belong to the Aesthetic Society or to the American Society of Plastic Surgeons, their requirements are almost 3 times as much as what the state requires in order to maintain membership. I personally like to keep up with the latest advancements in cosmetic surgery. The latest advancements, however, do not necessarily reflect what is best for the patient. So I always like to be able to assess a procedure before I introduce it into the practice. When the patient walks into our office, they find that it's the furthest thing from a medical office. This is a very welcoming environment, very rich in colors. The staff at Imagos Institute of Plastic Surgery has been fully trained. They're compassionate. They're just very caring. In addition, a lot of them have had their own cosmetic surgery, so they're able to identify with that patient who's about to undergo this transformation, and they can hold their hand each step of the way. All of the surgical procedures that I perform are performed at outpatient surgical centers. These are accredited facilities by the state of Florida. In addition, I also operate at accredited hospitals. It's important to realize the safety is the #1 factor when I undertake a patient's transformation. I think as a cosmetic surgeon, I have frequently underestimated the impact that I have had on patients' lives. And it humbles me greatly when I realize that I have impacted a patient's life forever. Their self-esteem has improved, their relationships have improved, and overall, it's just a very, very satisfying and rewarding experience for me professionally.